Detailed observation of nail color, shape, and texture offers diagnostic clues to many diseases. To watch the Spanish version of this video, you can find a link in the description box. Healthy nails are usually smooth and uniform in color, so changes in these characteristics can be indicative of a person's general state of health. The nail disorders that justify a visit to the doctor to specify the diagnosis and institute the corresponding treatment include spoon nails. Koilonychia or spoon nails is a disorder in which the nails become thin and concave, giving the impression that the center of the nail bed was removed with a spoon. This change may be a sign of iron deficiency anemia or a condition called hemochromatosis, where the body absorbs and stores too much iron from food. Nails with fungus. Onychomycosis is a disorder caused by the invasion of fungus in the nails of the hands or feet. The color of the nail can be whitish or yellowish and darken as the mycosis progresses. The free edge of the nail becomes thick, woody, and brittle, and over time can cause complete destruction of the nail. Nails with white spots. White spot nails or leukonychia can be caused by an allergic reaction to substances applied to the nails, such as varnish, enamel, or acetone, but they can also be an indicator of a lack of nutrients such as zinc or iron. Yellow nails. Nails can turn yellow from old age, the use of acrylic nails, or the application of nail polish. Another cause is the accumulation of tar and nicotine in smokers. Additionally, they can also be a symptom of diabetes and liver, kidney, and lung diseases. Nails with horizontal white lines. Horizontal white lines on the nails or bows lines are usually due to direct trauma, but can also be the result of a more serious disorder, in which case the lesion will be seen on more than one nail at the same time. The diseases that can cause this alteration include psoriasis, uncontrolled diabetes, circulatory diseases, or a severe zinc deficiency. Teres nails. In this class of alteration, the lunula covers the entire nail plate, except for about 2 mm at the distal part, so that the nail appears completely white with a thin pink stripe at the end. These disorders can appear due to aging, but in other cases, it can also be a sign of a liver problem, such as cirrhosis or a kidney or heart disorder, as well as type 2 diabetes mellitus. Black or brown nails. Black or brownish pigmentation of the nail plate is called melanonychia. It can be a result of trauma or fungal infections, but it can also be due to the use of chemotherapy and anti-malarial drugs. Dark marks or painful bumps on the nail require an immediate visit to the doctor, as they could be due to subungual melanoma, an aggressive form of skin cancer, which is fortunately not very common. The vast majority of pigmented nail lesions are not melanomas, but subungual hematomas in which a dark spot is observed. Fingers on drumsticks. This nail disorder is also known as clubbing or digital clubbing. In this case, the nails curve downward and their appearance resembles the rounded part of a spoon turned upside down. Clubbing can be familial, idiopathic, or acquired. The acquired form is usually secondary to lung, heart, or liver disease mainly. Nails with splinter bleeds. This alteration consists of longitudinal thin reddish-brown lines located under the nail plate. Trauma is the most common cause of this, but it also can occur from endocarditis, which is an infection of the heart valves, and can represent vascular injury from inflammation of the blood vessels or microscopic clots that damage the capillaries. Fragile and brittle nails. Lifestyle factors such as spending a lot of time with your hands in water, using nail polish remover, being exposed to chemicals, or living in a region with low humidity can lead to shiny, smooth, and brittle nails. They're also sometimes seen in hypothyroidism and menopause. Nails with vertical stripes. Vertical stripes are generally a normal sign of aging. They can become more prominent over the years and are not a cause of concern. However, in some cases, they can also reveal a deficiency of nutrients, vitamin B12 and magnesium. Peaked or nails in thimble. The presence of pinpoint depressions on the surface of the nail plate is called pitting, thimble nails, or pits. These depressions move distally as the nail grows. They can appear in the following diseases: psoriasis, alopecia areata, eczema, sarcoidosis, and pemphigus, among others. Onycholysis. Due to an alteration in the nail bed, detachment of the distal nail plate occurs, which acquires a whitish coloration. The most common causes are trauma, psoriasis, and onychomycosis. However, a relationship has also been seen with diseases such as hypothyroidism, hyperthyroidism, pellagra, porphyria, syphilis, and chemotherapy treatment. They have also been observed in pregnancy. As can be seen, nail disorders are a heterogeneous group of different origin, diagnosis, and treatment. To obtain diagnostic clues, it's important to examine all of the fingernails and toenails, as well as the surrounding soft tissues. This allows for early identification of nail abnormalities and initiation of treatment as soon as possible to preserve nail function and minimize impact on patients. So, on the next visit to the doctor, it's recommended to go with clean and unpainted nails, which allows not only to assess their appearance, but also to measure oxygen saturation if necessary.